Today we are going to cover post-operative recovery after a rhinoplasty. This video is for those who are interested in having a rhinoplasty and are concerned about their recovery and how to make it smoother and faster. Firstly, you need to understand that the recovery depends upon the grade or the extent of the rhinoplasty. The more minor or simple correction that you would be doing for rhinoplasty, recovery is obviously going to be faster. And the more complex, recovery is going to take time. So if you're only considering having maybe the tip surgery or alar-based surgery, recoveries obviously will be fast. But if you're having osteotomy where the bones are fractured and moved in, then the bones take time to heal, there's a lot more swelling, and the recovery is going to be longer. So speak to your consultant, plastic surgeon, and try to understand the gravity of the surgery and what the recovery time is going to be like. But despite all of this, and let's assume that you are having the most extensive rhinoplasty, then there are still some basic tips that you can do to hasten the recovery. One of the problems that rhinoplasty patients have after surgery is infections that they get because of the commensals. Now, what are commensals? Commensals are those bacteria which are normally harboring on our skin. Similarly, there are bacteria inside the nostril, and these bacteria can enter into the wounds and lead to a low-grade inflammation which causes excess swelling. So those who have bad bacteria, they would have even worse swelling or infections. So you could start by applying an antibacterial ointment in the nostrils even before the surgery for maybe 4-5 days. It's a good habit to start cleaning the nostrils if you've never cleaned it from inside with water. People find it difficult to use soap and water inside the nostrils, but at least clean with water inside. There are many who don't even clean the nostrils from inside, but the nostrils also have to be cleaned of the bacteria. And this is a tip that would help in preparing yourself for the surgery. Now let's say that you've had the surgery. Then immediately after you've been brought out into the recovery room, one should start using ice fomentation. So you take a piece of ice, wrap it in a plastic or a handkerchief or a towel, and then just apply it to the side of the nose so that the swelling is controlled. Ice helps in limiting the swelling. The less swelling you have, the faster the recovery you would get. There's not much that you can do if you get bruising, because if you have a fracture osteotomy, then any bleeding there is going to trickle down here, give you black eyes and a bruise. There are techniques during surgery where we limit the bruise, and now our patients hardly get any bruise. But if you do get a bruise, then that bruise is going to take 3 weeks to get resolved and go through all the color changes that a bruise usually goes through, which is it will be black, then blue, then green, yellow, and then disappear. You can take arnica tablets and arnica cream you can apply topically to reduce that bruise faster. One tends to get a lot of swelling in the nostrils when you do a septoplasty or you've done any turbinate work or even osteotomy. The swelling inside is bound to block your nose. It will make it a little difficult to breathe, but the stents that we put inside the nostrils, they allow you to breathe. And you have to lubricate your nostrils, use saline water or liquid paraffin drops, and that keeps it lubricated and allows you to breathe. Usually the swelling is the worst on the 3rd day, but 4th day onwards it starts reducing. All the swelling around the eyes, that also reduces fairly fast. After that, by 7th day, swelling around the eyes is gone. To sleep slightly propped up, at least 20 degrees or a 30 degrees angle in this manner with pillows under your back and your head would help in reducing the swelling on the face. If you lie flat after a rhinoplasty, the swelling around the eyes and the face is going to be worse. So ensure that you keep a slightly propped up position with just maybe a 20-degree inclination so the head is above the heart, and then gravity will help in reducing the swelling from the face. So that's another note. Take your antibiotics on time, all the painkillers on time, and you would find that the swelling is resolving fairly fast. Once 2 weeks are over, if there are any splints that have been removed, then massage is another thing that helps in reducing the swelling fast. And there, it has to be massaged in a particular way, and I will cover that up in another video where we will tell you how the massage for the nose should be done. And that helps in resolving the swelling fast, and you will get a quicker recovery. The wounds heal up on their own by around 7 days time. After that, you just have to make sure that crusts are not forming. You're lubricating the nostril properly, keeping hygiene, using Q-tip buds or the earbuds, dip it in an antiseptic solution, clean the nostrils from inside, keep it absolutely crust-free and lubricated. Those are the points or tips that will help in a faster recovery. With this, I hope that you understand how to take care of yourself and what the recovery is going to be like, and it helps you in your rhinoplasty procedure. Thank you very much.